complication of cirrhosis. Now, the importance of cirrhosis to you and me is that it is associated with a number of complications. Complications which you and I may come across. So let's go through these complications. And the most important complication, probably to us, is that the patients are going to bleed. So anyone with jaundice and hepatitis are going to bleed. Anyone with jaundice and cirrhosis are going to bleed. And the reason why they're going to bleed is in two folds. Firstly, because you know all blood clotting factors are made and processed and manufactured in the liver. And vitamin K, if you remember, is a substance present in the diet which normally prepares these clotting factors, activating them so that they stop the blood from not clotting. And the ones which are particularly important are the ones which are vitamin K dependent. And those are factors 2, factor 7, factor 9, and factors 10. So anyone with jaundice and cirrhosis are going to bleed, and that is the reason, number one reason. The second reason is because they have a low platelet count, because of the very large spleen that many of these patients often have, a condition we refer to as splenomegaly. The other reason why you should know about chronic liver cell jaundice is that patients may go into what we call liver cell failure. And three important things occur in patients with liver cell failure. They're usually jaundice to start off with. Secondly, they get fluid retention and edema. And thirdly, they may go into coma or may become very drowsy and sleepy and disorientated. We call that hepatic encephalopathy. All those things are important from our point of view. So if you have a patient who is sitting in your chair, who is jaundiced, and on examining it sounds like chronic liver cell jaundice, they may show signs of hepatic encephalopathy. They may be drowsy, and if they're lying in front of you, they may have swelling of the ankles, they may have ascites in the abdomen. And what else happens in patients with jaundice? Well, patients with chronic jaundice can develop bone disease, and that is a complication with patients with jaundice, and that is due to failure of poor absorption of another vitamin, vitamin D, which is a fat-soluble vitamin, just like vitamin K. So if fat is absent, patients may get into trouble with their bones, they may thin their bones, and which may lead to fracture. So if patients have statorrhea, that just means a flow of fat, they could have problem with their bones. Patients develop an itch, and as I said to you earlier on, this is just an irritation of the skin due to high bile salt concentration. They deposit them underneath the skin, and patients actually find itching more distressing than being yellow, and that usually implies you're dealing with biliary obstruction. Patients with deep jaundice, obstructive jaundice, develop kidney failure, and that's a very, very serious complication of chronic jaundice. And patients may go night blind, again due to failure to absorb another fat-soluble vitamin, vitamin A. And so it turns out that if you have a patient with jaundice, you say to yourself, what's in it for me? I'm the dentist, I'm the dental therapist. Well, the first thing is that there could be a viral hepatitis, so I must protect my next patient, I must protect my staff, and I must protect myself. And so vaccine is possible for virus B, and I must take all the precautions, careful disposal of sharps, careful techniques, and they're going to bleed. And they will probably have a low platelet count. And if they're going to bleed, I must measure the prothrombin time and correct that with vitamin K. But most of all, Anyone with liver cell disease, jaundice, is a candidate for liver cell failure. And 3 important things occur in liver cell failure, if you remember. I just said that to you earlier on. They're jaundice to start off with. They get fluid retention and edema, and they may go into coma. So they might be very drowsy. So if they're lying in front of you and sitting in your chair, you surreptitiously look at their ankles to see whether they have ankle swelling. You look at their abdomen to see whether they have an enlarged abdomen, ascites, and they will probably bleed. So you mustn't take any teeth out, because if you did, they will bleed to death. And you mustn't give them any sedation, because if you did, they won't wake up again. Thanks very much. This is my first talk about liver disease. I hope it's an elementary, a very simple matter, but I hope that you've liked it, and if you have, please tick the box like and subscribe, and I will look forward to seeing you again.